Very welcome back to Ireland AM. Now, a quick note before we continue. Our next discussion touches on pregnancy loss, which some viewers may find upsetting. In January 2021, Laura Guild began experiencing irregular bleeding and severe abdominal pain. Within 24 hours of discovering she was pregnant, she was rushed into emergency surgery for an ectopic pregnancy.
To tell us more about her story, we're joined by Laura Guild and Master Consultant Obstetrician and Gynaecologist at the National Maternity Hospital, Dr. Shane Higgins. You're both very welcome to the show.
Thank you so much for joining us.
Shane, before we hear Laura's story, can you tell us what an ectopic pregnancy is and how common are they?
Good morning, Martin. So an ectopic pregnancy is a pregnancy that is implanted and develops anywhere other than the body of the uterus. So it can really implant anywhere, but the most common place would be the fallopian tube, where about 95% of ectopic pregnancies occur. But they can occur also in the cervix, they can occur behind a previous caesarean section scar, they can occur in the abdomen, but for the most part they will occur in the fallopian tube. And about 1 in 80 pregnancies will end in an ectopic pregnancy or will develop as an ectopic pregnancy.
And what are the causes of this?
Well, we don't understand the causes. We know that there are certain groups that are at a greater risk. So patients who have had pelvic inflammatory disease or abdominal surgery where there might be adhesions that can affect how the fallopian tubes transport the fertilized egg. Patients with a history of endometriosis, older patients who've been through IVF, they're at greater risk. But bearing in mind that at least 50% of ectopic pregnancies occur in patients who have no known risk factor. Wow. So any patient is at risk of developing an ectopic pregnancy.
OK. Laura, tell us your story. When did you discover you were pregnant? When did you discover something wasn't right?
So I had the coil in, and the coil had kind of always been messing with my period, so it was kind of hard to track. And then in November of 2020, I didn't get a period, so I thought I better take a test. You know, took a test that came up negative, so I thought, OK, it's just the coil messing up with me. December then, I started what I thought was my period, but I bled for the whole month. And again, was thinking, probably not normal, but could be the coil, whatever, you know. But my partner was like, this isn't normal, like. Yeah. And it was the 2nd of January, then I woke up in excruciating pain. And I was thinking, to be this long on my period, I shouldn't be this painful, like. So my partner convinced me to call KDoc at the time. And I could tell by the questions that he was asking, he was thinking ectopic. So he goes, yeah, come on in. So I went in, this was that night then. So I got in about 11:30 that night. And most women, if you go in for a sore toe, they take a pregnancy test, you know, and they just throw it in the bin. But he put it on the side. And I was thinking, that's a bit unusual. Like, so I said to him, I was like, I assume that's negative. He's like, oh, we'll talk about that in a minute. And then he says to me, OK, look, you're positive. He goes, it's a weak positive, but it's positive. He goes, I can't say 100% it's ectopic, but you need to go into a hospital like right away and get a scan. So I went to Portlaoise and they brought me straight up, like didn't even have to wait in A&E, just rushed straight up. They did the scan and they just said, yeah, they're like, this is looking like it's ectopic.
Were you aware of what an ectopic pregnancy was and what the risks were surrounding it?
Yeah, because I knew having the coil can heighten your chance.
You had the copper coil, didn't you? Not the marina coil, which has got is that right?
It was, yeah, the one that doesn't have as many hormones. And so I knew, and so I was actually quite hyper alert about ectopic, but I think I was a little bit in denial because I was like, I knew about them, but I was like, that's not going to happen to me, you know? But I'll never forget the words that they said in the hospital to me. It was, we have a positive pregnancy test, but an empty womb. And I think that's when my world just crashed down around me then.
So you didn't, up to then, you didn't know you were pregnant. So you didn't have all the hopes and, I suppose, joy and all that sort of stuff. No. But then when you hear in the space of a couple of minutes, yes, you are pregnant, but it's ectopic.
Yeah.
How did you feel?
It was actually horrible. The drive from KDoc to the hospital, I was actually cradling my stomach because I was kind of thinking, there's something in there, like maybe it's not ectopic, even though with the pain that I was in and the bleeding and everything. Do you know what I mean? It was almost like I felt like if I hold on my stomach, I can hold on to it, kind of a thing. And this was during COVID time, so I was on my own in the hospital when this happened then as well. Now they eventually let my partner in, thankfully. But getting the official diagnosis that yes, this is and you need surgery, I was on my own
And
for that.
it wasn't just it was immediate surgery.
It was immediate surgery. Yeah, it was like we need to go now. Like, and I hadn't fasted. You know that you're supposed to fast for surgery, so I was panicking. Then I was like, I haven't fasted, and they basically said it would be more dangerous to wait till you'd reached your fasting period than to not have this surgery.
Shane, the dangers of an ectopic surgery or ectopic pregnancy as
The
well.
dangers, as Laura experienced, is that if it is implanted into the fallopian tube, which is a very delicate structure, it can easily erode its way through into the vascular supply of the tube, and that's where you get the ruptured ectopic, which can actually bleed and can be quite dangerous and life-threatening. And the kind of presentation that Laura presented with is at one extreme end, where you don't know you're pregnant, or even if you do know you're pregnant, you present with pain, bleeding, but you're bleeding into your abdominal cavity and you can lose an enormous amount of blood, and that's what we would look for on ultrasound scan when it comes to making that diagnosis. But you do have patients at the other end who know they're pregnant, there's no location identified on ultrasound scan, and that's where I suppose the investigations begin to identify where the pregnancy is. But life-threatening bleeding is the biggest risk to a patient with an ectopic
And
pregnancy.
surgery is the only option.
Well, there's 3 ways you can manage an ectopic pregnancy, but it very much depends on when you pick it up. In Laura's case, surgery absolutely was the only option. For patients who are identified much earlier, there's conservative management where you see that the pregnancy hormone is declining and the patient is well, very well, clinically very well. And then there's the intermediate group where there is an identifiable pregnancy not in the right place, but it meets the criteria for medical management with a drug called methotrexate, which avoids surgery. About 15% of patients will require a second dose, and maybe up to 10% will end up going on to surgery. But it is a way in which you can avoid surgery, but it means the pregnancy has to be identified much earlier.
10% go on to surgery then?
Yeah.
Yeah, and that can be quite drastic really in some instances.
It is. I mean, most of the surgeries that we undertake now for ectopic pregnancy are laparoscopic or keyhole surgery, but it does involve the patient most likely losing a fallopian tube.
Okay. Laura, I'm just thinking of you having to sign the papers to go down for surgery and then the waking up afterwards. And that must have been traumatic for you.
It was like I had to sign consent to have this operation, and I think that was probably one of the hardest things because I knew I had to have this surgery. It was life or death, but I felt like I was signing away my baby. So I have my notes and my signature. It's just shaky because I was just having to sign this was probably one of the hardest. I felt like I was betraying this baby almost as well, you know. And then waking up, I was actually put on a ward with newborn babies.
Oh.
So I was hearing all these babies crying while I'm lying there, hardly able to move from the pain of the surgery, you know, and that was very tough.
With all these pregnancy hormones through your body as well,
Yeah,
of course.
yeah.
And
Your body thinks you...
Yeah, like that's the thing. I didn't feel the pregnancy hormones building, but I felt them dropping.
Wow.
And that was really difficult as well because I could literally feel it all slipping away. You know?
Was that anger as well that kicked through?
Oh yeah, like I was. That was definitely I was very upset, but then anger kicked in very quickly. And I remember even when I was in the hospital and I needed to go to the bathroom, and I was doubled over, and I was walking to the bathroom in agony. And this woman comes out with her brand new baby, and you know, like the little cots that you can push. And to me, at the time, in my eyes, it's like she was walking on the runway. You know, she's like pushing, and I was so angry. And I was like, this woman has this beautiful baby, and she's perfectly fine, and I'm here in agony and pain, and I have nothing.
Now, we do have to say, at the moment, you have a gorgeous 14-month-old who is bouncing around and making you exhausted, but worth every...
Probably slapping the telly now.
Going, there's my mammy. But it wasn't an easy path to having him as well, was it?
No, it wasn't. So yeah, I got pregnant again. No, I was worried because I only have one tube as well. So I was like, how is this gonna work? And so yeah, I got pregnant again, but then unfortunately that was a miscarriage, and then got pregnant again. But the joy of pregnancy was kind of taken away because it was like me and my partner were like, okay, yay, you know, positive pregnancy test, but let's wait and see.
Yeah.
You know, it was very much straight away. It was more, okay, I have to get in touch with the doctor now, I have to get my early scan. And it was all more very clinical than, oh, this is all so exciting, you know.
Yeah. Shane, for Laura, like that joy was taken away because of the anxiety that the next pregnancy and the one that followed would have brought. Are people who've had ectopic pregnancies susceptible to another one?
Yes, they are. They're at a slightly greater risk, although for the majority of patients, as Laura can attest to, they will have a successful pregnancy. So your risk after an ectopic pregnancy of having another is about 10%. So 90% should go on, unless there's another complication, they should go on and have a successful pregnancy.
Okay, let's focus on the 90%.
Yeah.
The fact that it's more positive, and you've got and you've got a bouncing bundle that's breaking up the house right now because Mommy's on the telly.
Yeah, destroying the place.
Yeah. And of course we have to, even though there is increase, like you have one fallopian tube, but you still manage to okay, so it's not, there's maybe people here who are watching the show today who might be feeling very down. It might have happened to them recently as well, but there is hope, and I suppose there's always information and advice for people out there as well.
Yeah, absolutely. I mean, we run an early pregnancy advisory centre, our advisory unit, so patients can go, if they want to discuss it, they can go and see a gynaecologist. But also, I think it's very important to point out that if you do become pregnant again, you should go for early ultrasound scans to ensure that the pregnancy is implanted in the body of the uterus and not elsewhere.